Welcome to the Explainer. So today, we're going to talk about something huge, how new science is forcing a major rethink of a medical rule that's been set in stone for decades, a rule that really impacts the quality of life for millions of breast cancer survivors.
For as long as most oncologists have been practicing, this one sentence has been an absolute, undisputed commandment in medicine. And the logic, it seemed so simple, right? If some breast cancers are fueled by hormones, then giving those hormones back must be like throwing gasoline on a fire. But, as we're about to see, the real story, it's a whole lot more complicated than that.
Okay, so let's dig in here. To really get what's happening now, we have to understand where this incredibly powerful rule came from in the first place. I mean, this wasn't just a guess. It was built on some major clinical trials that seemed to give a very clear and, frankly, a very scary answer.
So let's go back a bit. In the late 90s and early 2000s, two really big, landmark trials were launched to try and settle this question for good. The first one, called the HABITS trial, was actually stopped early because the data coming in was just that alarming. And then a few years later, another trial, LIBERATE, seemed to just hammer home the medical community's worst fears.
And wow, the results were stark. I mean, just look at the difference here. After only 5 years, the chance of the cancer coming back for survivors on hormone therapy shot up to nearly 22%. Compare that to just 8% for the women not taking it. That's a 14-point gap, a massive, dramatic finding that would go on to shape medical practice for an entire generation. And it didn't stop there. The evidence just kept piling up. The LIBERATE trial, which was looking at a synthetic steroid, also found a pretty big jump in cancer recurrence. It wasn't quite as dramatic, but it was pointing in the exact same really worrying direction.
So what's the takeaway here? Well, these two trials, they basically just slammed the door shut. Hormone therapy, or HRT, became completely taboo for breast cancer survivors. Women who were suffering from just debilitating symptoms, horrible hot flashes, insomnia, bone pain, they were essentially told, sorry, you just have to tough it out. And that often came at a huge, huge cost to their quality of life.
But, science is almost never that simple, is it? And it turns out, around the very same time, another big study, this one out of Sweden, was starting to paint a slightly different and honestly a much more confusing picture. It was the first real crack in this solid wall of fear.
And this is where it gets really interesting. When researchers followed these women for over 10 years, the overall rate of cancer coming back, well, it wasn't actually different enough between the groups to be statistically significant. Now, one specific risk, getting a new cancer in the other breast, was higher. But the big one, the really critical one, overall mortality, the rate of death, there was no difference at all.
So this just raises a huge question, doesn't it? If taking these hormones didn't actually increase a survivor's overall risk of dying, was the absolute, no exceptions blanket ban really the right way to go? It was a question that would just kind of simmer under the surface for years.
Okay, so now let's jump forward in time, all the way to 2025, because brand new data presented at a major cancer conference didn't just poke holes in those old assumptions. It threatened to blow them up completely.
So this new research was really smart. It focused on a very specific, very high-risk group, breast cancer survivors who carry the BRCA1 or BRCA2 gene mutations. These are genes that can seriously increase your cancer risk. So they compared the women who used hormone therapy after their diagnosis to those who didn't, and what they found was completely unexpected. And this is it. This is the moment where that old thinking just completely shatters. Get this, after 10 years, the survival rate for women who used hormone therapy was 93%. For those who didn't, it was 80%. Survival wasn't just not worse, it was actually significantly higher in the group using HRT.
So it really all boils down to this one number, 93%. It's a figure that just flies in the face of all those fears that were established by the older trials. And it suggests that for some women at least, the whole risk-benefit calculation might be completely different than what we've believed for decades.
So this just begs the question, right? Why are we seeing such a wildly different result now? Well, the answer is that the world itself has changed. Both the hormone treatments we're talking about and the cancer treatments patients get are in a totally different place today.
First off, the hormone therapy we're talking about today, it's not the same stuff they were using back then. The old trials used higher dose pills,
Now doctors are much more likely to use lower-dose patches or gels, and the regimens are tailored way more carefully to the individual patient. It just seems to be a much safer approach. And the other huge piece of this puzzle is that breast cancer treatment itself has been totally revolutionized. We have targeted therapies, CDK4/6 inhibitors. All these incredible drugs are so much better at preventing the cancer from coming back. So the baseline risk for a survivor today is just way, way lower than it was back in the 90s. The entire landscape has shifted.
Okay, so what does all of this mean for patients today? It means we're finally moving away from a simple, rigid no and into a new era of personalized individual conversations, where we're armed with a much bigger and better set of tools.
Now, to be super clear, this doesn't mean HRT is suddenly the go-to for everyone. Absolutely not. For many survivors, this powerful and effective non-hormonal toolkit is still the first and best choice. We've got antidepressants, certain seizure and bladder medications, and even brand new drugs that target the brain's thermostat directly. There are so many proven ways to manage symptoms without ever touching hormones.
And for more localized symptoms, like vaginal dryness, for example, we now know that treatments like estrogen creams, which barely get absorbed into the rest of the body, are an incredibly safe and effective way to dramatically improve a person's quality of life.
And really, this quote just sums up the new way of thinking perfectly. It's about getting past these reflexive, fear-based, one-size-fits-all rules from a totally different era of medicine. The goal now is to empower patients with real information about all of their options, not to limit them with prohibitions that might be outdated.
Ultimately, this whole story is a perfect example of how science is always moving, always evolving. And it leaves us with this really important question to think about. In this new age of personalized medicine, as our knowledge and our tools get better and better, how do we make sure our medical rules evolve right along with them?